Welcome to another episode of Medicare Industry Insider. I'm Rachel Brandmeier.
And I'm Chalen Jackson.
And today we're going to dive into off-label drug use. As we get through all of our clients, we see longer and longer drug lists. We're not doctors, we're not pharmacists, but we are continuously seeing a lot more doctors recommending drugs that are not for the use that they were prescribed for or the FDA has approved for. So that's what we're going to dive deep into today, getting down a long wormhole of off-label drug use.
Absolutely. And I think as we continue to see more and more drugs prescribed off-label, and I think, doing some of the research on this, seniors, kids, pregnant women are the three largest groups that receive off-label drugs, not so much because those drugs aren't safe, they're not effective, but because that's who we're not willing to run clinical trials on in some cases. So in a lot of cases, it may be that it's a drug that's prescribed that is indicated through the approval process for another group, for, say, healthy adults, but maybe not kids, not seniors. That's a really common way to see those non-approved uses go through the prescribing process. But we do continue to see a lot of things, and if you've ever looked over a drug list or tried to underwrite someone into a med sup and just seen that kind of head-scratcher drug going, why are they on that? Or if you've ever thought, well, this client lied to me. They told me they didn't have any health issues, but then here's this drug that means that they have heart failure, but maybe they're actually taking it for an off-label use. That is a really, really common occurrence and something that agents run into all the time.
Yeah, we're seeing that a lot. And going back to the, people taking them who are women, children, pregnant women, children, or seniors, I think you and I were talking about that as like a big thing where you go through trials and it's a lot of, healthy individuals, not, pregnant women. So him and I were just talking, and speaking of that, RSV, that new vaccine is something that was tested and approved by the FDA, but I'm sure it was not tested on pregnant women. So I actually have a friend who was trying to get it as a pregnant woman so that her child would have the RSV immunities, hopefully. But we've never seen it being tested on pregnant women. So it's going to be interesting to see not only that aspect of, who is actually getting it prescribed, but also why are you getting prescribed these drugs?
Well, and so that's a great point of why does off-label drug use happen in the first place? So the FDA regulates the creation and manufacture and distribution and marketing of prescription drugs. What the FDA does not have the authority to do is regulate the practice of medicine. So drug companies cannot market drugs for off-label drug use. Obviously, one of the big kind of in the news use cases is Ozempic and other diabetic drugs that have the super common off-label use of weight loss. Now, of course, since that became a big thing, you've seen Mounjaro be approved for weight loss, which is the same, active ingredients as Ozempic, just in a different dosage and a different indication, has been approved for weight loss now. But for a long time, we saw a lot of those semaglutide GLP-1 inhibitors being prescribed for weight loss, even though the approved use was as a diabetic drug.
Yeah, they actually removed all of those, because I remember my dad, who's a primary care doctor, he commented that a lot of people were getting more sick because he couldn't use the diabetic drugs as an off-label weight loss purpose. And he was like, all of them are pulled. I can get in a lot of trouble right now if I do this. So it's interesting just kind of to see the wave of FDA approvals and what direction, doctors and pharmacists and FDA has to go through.
Absolutely. And even though the FDA doesn't regulate the practice of medicine, it certainly doesn't mean that physicians or providers are blameless or that there's no accountability for prescribing those off-label drugs. And there are cases, court cases that occurred where there's been an issue of negligence or potentially issues of informed consent, where someone was prescribed something off-label and had a dire reaction to it because of an interaction with another drug or some other unforeseen or unaccounted for side effect. There are some cases like that, not enough to set a clear precedent of a requirement. There's no current requirement, at least, to provide informed consent if you're prescribing something off-label, at least not in most jurisdictions. So that's something where the case law has not quite been built up. adequately to really account for off-label drug use, and it doesn't put any guardrails in place for physicians. So every time they prescribe off-label, it's kind of a lottery. There is always that chance that they can get sued, and it's like I tell agents about their errors and omissions insurance. You don't have to do anything wrong to get sued, and you don't have to lose for it to be expensive. So off-label drug use can present that kind of issue for providers.
And that was exactly that situation. It was a legal case. It got huge in the news. So then, doctors and even hospitals, because a lot of doctors work for hospitals now, put scrutiny on not, prescribing a diabetic drug for weight loss, because at the time there was no FDA approved drug. So now there is. But like you said, it definitely goes through waves of like, okay, this is needed, but like we need to get FDA on track with this too. Another thing that we were talking about recently is this is the first year, 2023, that the approved FDA drugs is back up to speed prior to COVID, so 2019 levels, and how even like the weight loss drugs or things like that like people needed and wanted, there just wasn't enough clinical trials, there wasn't enough people in the FDA who could actually create trials and get these drugs processed and approved. So it's kind of exciting to see everything back to where it used to be prior to COVID. So we might see a lot more drugs getting approved for the off-label use in the future. But right now we're kind of still catching up from COVID.
Yep. Well, and, in some cases, a pharmaceutical company, a manufacturer, may have a strong financial incentive to pursue adding that as an on-label use for a drug, where they do, so Ozempic and Mounjaro are great examples of. There is such a market for that as a weight loss drug. It made financial sense for that company to pursue that as an approved on-label use for the drug. And of course, again, dosages differently, obviously approved as a different drug name and different indications. So in some cases, there is an incentive to do that. But for a lot of medications, either the off-label use is rare enough or infrequent enough, or there's not a strong enough evidence base to make it worthwhile or cost-effective to pursue that additional FDA approval for an additional condition, that sometimes they just kind of let the off-label use happen and they never pursue that additional approval to add additional conditions to the on-label usage for that drug. And again, part of that is because physicians have wide latitude in how they practice medicine. So the manufacturer knows they're not really losing anything by not pursuing it. But of course, that approval process can be incredibly expensive, especially when you get in some of these things for, really, really kind of off the wall or unexpected off-label uses. A great example, Prazosin, approved for the treatment of hypertension, high blood pressure, but it is also commonly used off-label to treat nightmares related to post-traumatic stress disorder. And you'll see a ton of different things like that in some of our show notes, examples of off-label use.
Yeah, there's a couple more that we noted, even like clonidine. It's used for hypertension, but the commonly off-label use is ADHD, which is like completely different. And then we have a couple that you probably have heard of, especially as an agent. There's a lot of common drugs that you'll see, like warfarin. That's used for AFib, but a common off-label use is hypertensive heart disease, which could potentially be a decline. There's also Wellbutrin, which is a depression drug, but the off-label is bipolar. So you'll even see other ones like, Zoloft is also depression, also for bipolar. So you're seeing a lot of these prescriptions that their main commonly used labeled where they're supposed to go for, like depression, is also bipolar. So that's how come some insurance carriers, knowing that they can be off-label usage, and if you see multiple of those, that person might have bipolar. If they were taking one for Wellbutrin and Zoloft, those are both depression. Well, they might also be for bipolar as off-label use. So,
and it is very, very common, especially to see a lot of those, depression, anxiety, antipsychotic medications that are some of the most commonly prescribed off-label, because they tend to get approved for a very narrow use case. However, psychiatrists and other providers are very often just kind of looking for the right mix of prescriptions to help manage symptoms for those individuals. Since body chemistries can differ so much, and oftentimes you don't necessarily have a clear diagnosis, between depression, anxiety, bipolar, ADHD, all these other issues that so many people face, especially in the senior community, increasingly. It is not uncommon for you to just play around with dosages and drugs until you find something that works for that individual person, regardless of having a firmed up diagnosis. So I think that's one of the big issues that, as we've talked about a little bit, underwriting can be a bear with these off-label uses of drugs. If you've got someone taking a schizophrenia drug, but it happens to be to help them sleep at night, which is another one that we don't that we see occasionally, or trazodone, typically for depression and often used for insomnia as well. It can really make underwriting an issue. Some carriers are going to be pretty open to explanations of this is being used to treat this, not this. Some carriers are going to say, listen, that's the drug, we're not taking that drug.
And they're going based off of FDA. Yeah. There was one on here that I thought was interesting. It was an oral prescription that is basically used to help with alcohol and opioid dependence, so helping people kind of get away from that dependency. Well, it's also used for things like compulsive hair pulling. So you'll run into stuff like that where it's like, oh, like this person, the insurance carrier might think it's, their opioid addiction or an alcoholic addiction, but it's really for hair pulling. So there's a lot of interesting off-label uses that you can find on prescriptions that then, like you said, either they're going to say it's an automatic decline or it's, we'll talk about it. Let's go back and forth with it. I would say a lot, we're leaning more towards carriers saying, no, here's your automatic decline list. And then you just are out of luck and having to go to the next carrier.
Well, and even for, I think one of the big issues with off-label drug use, and to be clear, we're not saying it's an inherently bad practice or that there aren't millions of people in this country who have benefited from off-label drug use, but there are some potential challenges. And I think one of the big ones is even for folks who already do have coverage, we're not worried about underwriting. It can be difficult at times to get coverage for those drugs, especially if you look at standalone drug plans or MAPD plans. Getting drugs covered for their indicated use is generally pretty easy, but if you're using something off-label, especially if it's a more expensive drug, a tier 3, a tier 4, something like that, it can be really difficult to get the prior authorization to use that drug off-label from the plan. It can be difficult, may have to see more step therapy type options for that. Use a couple things that are on-label uses before you move to an off-label drug, and it can definitely cause issues with that.
Yeah, and in addition to that, you're also looking at like side effects. Like side effects have not been tested on those off-label uses, so you could also run into situations where there's major side effects that maybe the doctor didn't even realize because it's an off-label use. So you're running into some of those issues as well. But like Chalen said, some people have benefited so much from the off-label practices because especially we're looking at a lot of prescriptions that are used for, bipolar or even heart disease, COPD, things like that, anxiety, sleep help. It's chemicals in your body. Like it's kind of trial and error. So I think a lot of doctors are using those for the trial and error of just like, well, maybe this one didn't work and it's FDA approved for this. This one might, it's not, but we can try it. And maybe that's the drug that ends up helping that person. So anytime you're dealing with like chemicals in a body, like it's definitely helpful for doctors to have alternative solutions, even if it wasn't prescribed or FDA approved for that particular reason.
Absolutely. And I think, just again, the big issue, the big thing for agents to be aware of in terms of action items is just, be at least a little bit familiar. If you do see a drug that looks out of place based on the medical history you've received from a client, or if you see something that doesn't match up, have that conversation with them about what their actual issues are, why they're taking something. We've all sat down with the seniors that, you're going over the drug list. Well, I take the blue pill for this and the big white ones for that and the little white ones for this. And sometimes they know what it was prescribed for, regardless of what the FDA indication for that drug is. So having those honest conversations with a client can really help in terms of underwriting into a med sup or some other product, even life insurance underwriting. It can also help when you start shopping drug plans and things like that and looking at coverage options, just to make sure that they're getting the coverage they need. So just have those conversations, talk about alternatives. It's some high-priced drugs or drugs that maybe you can't get approval for through the plan. We do see folks go through, say like the Canadian pharmacies or some of the online pharmacy systems to maybe get those prescribed. Use caution with that. There are a lot of cases where that is a perfectly legal and okay thing to do. However, there's also a lot of cases where it could actually get someone maybe not in trouble, but get those drugs seized at the border and they don't actually make it to them, and then they're out money that they really didn't have. So there's definitely a lot of kind of ifs, ands, or buts when it comes to those overseas pharmacies.
And as an agent, you're always looking for solutions and alternatives, trying to help this particular client. I will say, knowing the off-label use for those drugs, if they say, no, I take it for asthma and it's a COPD drug, maybe looking at some other drugs that they could then go back to their doctor that are covered by that plan. So that helps you kind of give that person some alternatives of saving money, maybe finding a drug that wouldn't raise those red flags, because maybe that person does want to add additional insurance, like life insurance and things like that, where a COPD drug would knock them out or a bipolar drug would knock them out. So just being cautious and like Chalen said, with where are you getting this information? What advice are you giving? But also keeping that balance of doing the right thing for this client and making sure that they're taken care of, they feel safe, and that they understand that you are, not a doctor, not a pharmacist, and you're only giving recommendations for them to talk to those professionals.
Absolutely. And I think use this as an opportunity to, talk to your clients multiple times throughout the year, make sure their drug buying process is going smoothly. And if you do start to see trends and issues with certain plans, with certain drugs, that's a great time to make some connections with pharmacists, make some connections with providers, and use that as a networking tool, saying, hey, I've got a lot of clients on this drug, on this plan, that are having issues getting prior authorization. Is that something you're also seeing? Is there a way that I can work together with you to help folks find better coverage, to help ease that process for everyone involved? So I think it's also a great networking tool when you can bring some of that insurance side information to those providers as well.
100%. So I hope you enjoyed this episode of off-label drug uses and got a little bit more insight that this is happening, how the FDA works, how doctors use those alternative uses to help particular clients who are maybe struggling to find a solution with what is prescribed for that use, and also kind of how you can use the off-label drugs to either network and help your clients in different ways. So thank you for watching, and we'll catch you next time.